Welcome to the InfoMullet YouTube channel. If you enjoy this content, please like or share. And if you'd like to support the InfoMullet by becoming a mulleteer, visit us on Patreon. We appreciate your support. From one media literacy to another media literacy, and this one's kind of more on the blue side, this chart drove me nuts this week. I saw this chart everywhere. Hopefully some people saw this. I might put it on the InfoMullet. This is a chart that claims to show that socialized medicine, they basically, the chart is like, look at all these, and these are what waves look like. And they're like, oh, look, the United States is up here, for-profit healthcare bad, socialized medicine down here, really good. And it comes from this website called Common Dreams that I think Ed described as all the quality of the Drudge Report, but less original content. So this chart actually isn't created by them. It's not even from the CDC. If you when you go to their website, they claim this is from the CDC. The actual charting application comes from the European Union CDC, so they botched that. And the original chart was simply showing that as a pandemic response, right, these countries have are closer to their wave one troughs. Again, we talked about wave one trough, right? Look, you start low, you hit a peak, and you get back down towards that low. That's what a wave looks like. US, wave 1.5, you start at a trough, you get to a peak, you go down a little, you're back up to your next peak. You haven't had that decline to trough. And the problem is anyone who's been following the InfoMullet and sees that these countries like France, United Kingdom, and Italy as examples of socialized medicine has made these countries successful doesn't know what they're talking about. It is completely wrong. The United Kingdom has performed worse. France has performed worse. Italy has performed worse. These are some of the worst countries. Now, Australia and Canada have done very well. But it gets into this kind of myth that, and this is, again, it's a website promoting socialized medicine, not surprise. But there's this myth that the hospital healthcare system model in a country was a useful predictor of their success in dealing with the pandemic, and that is completely wrong. So of course, let's go to the data. I put this chart together. On the top, from left to right, most socialized is the kinds of healthcare. So universal government funded, that's the NHS in the United Kingdom. You know, the government pays for all healthcare. It's socialized medicine. And then you go down, universal public insurance, universal public-private insurance, universal private health insurance, non-universal insurance. And so you can rate countries sort of 5 to 1, 5 being the most socialized healthcare, 1 being the least. And then we can look at the countries, and I just pulled some out here. I marked in yellow the ones that were on the chart. And this is from the New York Times. This is from this morning, right? The country, its deaths per 100,000, what its healthcare system is, and the equivalent deaths that would be in the US. And right away, you realize United Kingdom and Italy, we're at 128,000 deaths in the US. If we were the United Kingdom, we'd be 217,000 deaths right now. That is not an indication that socialized medicine did all that much in United Kingdom, because the pandemic response they chose was the wrong one. They went with induced herd immunity. They completely ignored the advice. They reversed it. They botched it, and they really suffered for it. Again, France and the United States are closer. Now, we may catch up to these over time because we're still increasing and they've done their waves. But again, these results are not, I mean, you can look through there and there's no real correlation. Austria, very low, not socialized medicine. Israel, even lower. You know, you even have here Jordan and Indonesia, not exactly high resource countries. They have non-universal and they've had very low. So the thing that matters, that this media literacy I want to get across, it's not whether your healthcare system is socialized or private or anything like that. It has to do with what pandemic response did you choose, when did you put it in place, and how effective were you at implementing that. And what's just funny to me is a lot of the ones on that chart are really bad because they're not the examples. Like if I were going to pick one that did well, I'd pick Germany, Israel, South Korea. You know, I'd pick those ones, but those aren't all socialized medicine. So thanks for watching the video. Hope you enjoyed it. If you'd like to follow the InfoMullet, visit us on Facebook or Twitter. And if you'd like notifications when we post new video content, click on the red subscribe button below the video. If you've ever wanted to become a mulleteer and support the InfoMullet, visit us on Patreon. We appreciate the support.